Data is critical to understanding what we are doing in the NHS. It's a way that patients can be reassured that the quality of care they're getting in the hospital is as good as it could be, and that we can identify areas of good practice as well as areas of less good practice. One of the big criticisms that most clinicians have is that poor data in means poor data out, and trying to get the profession on board with the idea of using data to sort of compare hospitals is actually quite an uphill struggle, but we are getting there. And the more that clinicians engage with the whole high quality data entry, the more reassured they are that how the hospital is portrayed and how they and their teams are portrayed is actually a fair reflection. Gastroenterology has been using data for quite a long time to compare, particularly in endoscopy, how different units are doing. That was quite a challenge to introduce, but has seen real benefits in the way that patient care has been improved. We've been able to make sure that the quality of endoscopy that patients are getting is of a really high standard around the country. I think that trying to get some people to perhaps change the way they work has been one of our big challenges. But I think if you talk to people now, everybody's seeing the benefit of it. I think gastroenterology is, it's not unique, but it helps because it's a procedural-based specialty. Trying to understand what's going on in the non-procedural specialties, be it geriatric medicine or be it acute medicine, I think is a bit hard, and that's one of the challenges that we've really got to grasp. But I think it's doable, and the wealth of different data tools that we've got to assess patient journeys is getting bigger and bigger. And we've got the computing power now to really crunch all that data to meaningful effect. I think gastroenterology has been lucky to be sort of towards the front of the field, but I think everywhere else is catching up. I used to do a lot of stuff with Workforce in my early days, and I could handle a spreadsheet, and the amount of information that we had available then sort of allowed you to do that. The huge volume of data that we have now is so great that we can't manage that without the use of AI and other tools. Big data has big promise. Clearly the public have their concerns about how their data might get used, and we have to address those. But I think the promise that we have, and it's a mostly untapped reserve of information that we can use to improve patient care, is really exciting. I think that's one of the areas that's going to develop a lot in the next 5 years. One of our jobs as clinical professionals is to get our patients on board with that, help them to understand that we're not misusing their data, and in some way showing them how that data is being used to improve their care. I think once we've sort of won that battle, then it'll become much easier.